After years of drama at White House COVID updates, Dr. Anthony Fauci, the nation's top infectious disease expert, gave a final briefing to reporters Tuesday before leaving government at the end of the year. Introducing Fauci at the podium, one more time, White House Press Secretary Karen Jean-Pierre said the country is stronger and healthier because of its leadership. Fauci pressed the idea that Americans should get up to date on their COVID and flu shots ahead of winter, making a final pitch in a long effort to explain to Americans the safety and efficacy of the COVID vaccines.
Yeah, well, let me answer the second question first, is that the vaccine is well matched to the circulating strain. So that, again, is another really good reason to tell people what Dr. Jar and I and others have been saying about get your flu vaccine, because that's one of the issues that we're going to be dealing with this winter that we can do something about. When you have seasons of very low flu, which got kind of bumped off the table by COVID, when you have respiratory illnesses that circulate, they sort of have niches that you very rarely have one and the other at its peak. So when we were at a peak with COVID, all the other respiratory illnesses, including RSV and including flu, were very, very low compared to other years. When you now open up in society, people now maybe are under-vaccinated. Not everybody's wearing a mask. We're trying to get back and are getting back to some degree of normality. You almost have like a rebound effect of something that was very low for 2 seasons. If you look at the flu over the last couple of years, in the peak of the COVID back in 2020 and 2021, we were having the lowest flu seasons on record. So it's not surprising that we're seeing it return back.
And if you don't, one more if you don't
Sure.
mind. This is your last appearance at the podium. You became a household name in large part because of your appearances here at the early stages of COVID. What do you want Americans to remember about your service in government?
Well, I think what I've accomplished in my 54 years at the NIH and my 38 years as the director of NIAID, although COVID is really, really very important, it is a fragment of the total 40 years that I've been doing it. So I'll let other people judge the value or not of my accomplishments. But what I would like people to remember about what I've done is that every day for all of those years, I've given it everything that I have, and I've never left anything on the field. So if they want to remember me, whether they judge rightly or wrongly what I've done, I gave it all I got for many decades.
I'm hoping I can ask quickly about also the XBB variant that's rising from India and Singapore. What should Americans expect as that variant continues to rise? And just to take a step back, I know you were encouraging folks here to get their latest booster, but should Americans expect what we've been seeing in terms of more cases, not as many hospitalizations? Just a step back, what should Americans expect when it comes to COVID?
Well, what Americans should expect is from our experience that you never can definitively say what to expect, but you should really take some comfort in knowing that we'd have within our wherewithal to mitigate anything that comes our way. Because we have flu vaccines, we have COVID vaccines, we have testing, we have the option under certain circumstances with good judgment to wear masks where appropriate in indoor congregate settings. You look terrific, right?
I have no problem in here wearing a mask. Thank you.
All right, we gotta move on. Go ahead, Alex. Go ahead. Alex, don't be disrespectful. You're being disrespectful. Hold on. No, wait, I did not call on you, Stephen. Go ahead, Alex. You're next.
Green. My first question is, last year, 2 questions. The first is, last year we were really kind of hoping that the holiday season would go well, sort of look normal, and then Omicron came along and sort of disrupted a large chunk of January, February schools, flights. Are we seeing a similar dynamic, especially with some of these new subvariants coming along? And then my second question, Dr. Fauci, for you specifically, what was the most difficult moment of the pandemic response for you throughout the last 2.5 years?
I'll start with the first, and then obviously Dr. Fauci can answer the second. So the short answer is no. First of all, you can't predict with any certainty. So we don't know what Mother Nature is going to throw at us. That said, these subvariants, obviously we're tracking them very closely. The good news is, even if you see a diminishing of our vaccines, they're still effective against these subvariants, way more effective than the original vaccine, right? So I feel very confident that if people continue to get vaccinated at good numbers, if people get boosted, we can absolutely have a very safe and healthy holiday season. Well, there's always a caveat here of things out of the left field you can't predict and you can't, but nothing I have seen in the subvariants makes me believe that we can't manage our way through it effectively, especially if people step up and get their vaccine.
So that's a really difficult question to answer, but the most difficult because, we've all lived through almost 3 years of the most horrendous outbreak that we've experienced as a society in well over 100 years. But there are certain things that stand out. I mean, I could probably write an essay on all the things that were difficult time. But one of the things as a physician whose goal in life is to care for patients and to prevent and treat illness and ameliorate suffering is that I remember back in my days in medical school and when I was an intern and a resident, when a patient came in, whether or not the patient didn't like you, was angry with you, whether it was a rich person or a poor person, you treated everybody the same because you cared about them and you wanted everyone to walk out healthy. So when I see people in this country, because of the divisiveness in our country, of not getting vaccinated for reasons that have nothing to do with public health, but have to do because of divisiveness and ideological differences, as a physician, it pains me because I don't want to see anybody get infected. I don't want to see anybody hospitalized, and I don't want to see anybody die from COVID. Whether you're a far-right Republican or a far-left Democrat, it doesn't make any difference to me. I look upon it the same way as I did in the emergency room in the middle of New York City when I was taking care of everybody that was coming in off the street. So that's the thing that troubles me most about this.
Dr.